I'm Kathy Mulford. I'm a nurse practitioner in the Spine Institute at the University of Maryland, St. Joseph's Medical Center, and I specifically work with osteoporosis patients as the osteoporosis coordinator. So osteoporosis is a disease of the thinning of the bones, and as we get older, our bones thin. As a result, we are at higher risk for breaking bones, which can unfortunately lead to surgery. And so we try to help patients understand how to keep their bones healthy and prevent fractures. We find that patients who are older, particularly females, we have patients who are on certain medications also that cause osteoporosis or contribute to osteoporosis. We also have a risk factor of strong family history. So if your mother or father had osteoporosis, you are at higher risk for osteoporosis. And then another risk factor is if you've had a previous fracture that didn't occur with a major trauma. So if you slipped and fell and broke a hip from a simple fall, that's a risk factor that puts you at higher risk for having osteoporosis. And so we have to be very diligent about making sure our patients are evaluated for bone health issues and osteoporosis to try to help prevent future fractures. So osteoporosis is diagnosed via a variety of methods. First, a history and physical is done on the patient to determine their history of medical problems, chronic medical diseases that can contribute to osteoporosis. We also take a history of the family to see if there is osteoporosis in the family, which puts you at more risk. And so the history is done first, and then we do a physical exam to see if you're having any back pain that may lead us to think that you have a suspicious fracture in your spine that you didn't know about. And then we will do testing that includes a bone density test, or otherwise known as a DEXA scan. And that looks at how thick or thin your bones are and what risk you have in terms of developing osteoporosis or having an increased risk for fractures. We also do blood work to check your calcium and vitamin D levels, and we look at your blood work in general to make sure there's no other secondary causes that may be causing osteoporosis or problems with your bone health. Here in the Spine Institute, we see patients who are suffering from back pain, have spinal issues, and a fair amount of those require or can require surgery. If surgery is done on a bone that's not healthy, such as an osteoporotic bone, surgery may not be successful or as successful as it could be if we have healthier bones. And so our surgeons here at the Spine Institute are very aware of the fact that if they're going to be doing surgery on bones of the spine, they want to make sure those bones are healthy. And so they will request a osteoporosis evaluation so that we can look at their bones and try to get their bones as healthy as possible before their spine surgery. We also see patients who have broken bones of the spine. They come in with complaints of severe back pain, and we identify broken bones of the spine. And as a result, that worries us. It sends a red flag up that there may be some thinning of the bones that need to be treated. And so our osteoporosis center within the spine center helps to coordinate that care for spine patients. I've been in the spine specialty for about 20 years, and in the early parts of my career, a number of my spine surgeons and I were identifying fractures of the spine and treating them, but we weren't treating osteoporosis at that time. But we would tell our patients that we were concerned that they had osteoporosis, and we wanted them to follow up with their primary care or another specialist regarding osteoporosis. What we were finding is that patients were not getting that type of treatment on a regular basis and kind of falling through the cracks, and they were returning to us with other fractures. And so about 15 years ago, we decided to start our own osteoporosis center to make sure we could help these patients avoid future fractures once they had a fracture. And as our osteoporosis center evolved, we took on the role of trying to prevent osteoporosis also. So I have been very pleased with the success of our practice, our osteoporosis practice, in helping patients identify their bone health issues early on to, one, prevent the fractures, and two, to try to help those who have had a fracture prevent future fractures. So it's very satisfying to be able to coordinate this osteoporosis program into a spine institute where we can help patients avoid fractures. I also find that it's a very fulfilling job. There's nothing better than a patient coming in and after being on treatment for osteoporosis saying to you, I really feel much more confident in my life now that I know that my bones are being protected. So it's very fulfilling. I enjoy what I do, and I couldn't think of a better place to practice at this time. One of the important things I think patients need to realize is that they should be their own advocate amongst their healthcare providers, asking their providers about their bone health and when it's time to have a DEXA scan and when it's time to get evaluated. And hopefully it's not after a fracture, but before a fracture, so that we can prevent future fractures. At 50 years of age is the age that women should start to think about having a screening DEXA scan to see where their bones are at that age. Men, it can be a little bit later, usually around 60. Particularly if women are at high risk, they need to start at 50. If they have no risk factors and have not had a broken bone, they can put that initial DEXA scan off until about 60, 65. But they should always be talking to all of their providers about when the best time to start looking at their bone health and beginning that process of testing.